Good evening, everyone. So, on this side, this is Tamalika Chakraborty. So, I'm yet here with a new video in awareness section, that is frequently asked question in autism, autistic spectrum of disorder, and attention deficit hyperactive disorder. So, the first question which comes to our mind is that what is autism or autistic spectrum of disorder? So, first and foremost thing is that I'm speaking of disorder. It's not a disease. So, it is not a neurological disease. Rather, it is a disorder. Like I give you an example. Like somebody asks a question to a child gives a normal answer, right? So, it depends upon what is the stimulus. A typical stimulus will actually lead to a typical response. But when the stimulus is different, the response is also different. So that's why we call the child under the spectrum as atypical. They are not, no, it's not, you cannot say that they are normal. They are atypical because the stimulus is a bit different, to which they respond in a different way. So that's the definition for everyone. Second thing is that why it is called a spectrum of disorder. What is spectrum of disorder in this particular, the term autism? So, spectrum of disorder is that in this, every child is different. They behave different. They have some typical, behavior which is very specific to them. They have some typical strength that is specific to them. So that is why the variation among this particular population of child with this disorder actually is different. So that's why it is a spectrum of disorder, because we cannot compare one child with another child. The third point, that is a very important point for the parents who is nurturing an autistic child, or a parents who is unaware that his or her child is actually under this spectrum, how he or she will understand this. So for that, the most important thing is that you have to look into few things. First is whether the child is having an eye contact. A small baby, even if one can do something to draw attention, that baby gives attention to that particular thing. But these children do not give attention to the things you do. Suppose you call their names, they will not respond to that. Suppose you are talking to them, they will not keep an eye contact with you. They will be looking here and there cluelessly. And that is what is actually the hallmark, the identification of this kind of emergence of this kind of disorder. Apart from it, children actually will do repetitive activities, anything like, for example, rotating a wheel of a car. So a toy car, he's constantly rotating the wheel without looking here and there, and is very much concentrated on just rotating. So that is a repetitive behavior. He doesn't points to anything. He or she doesn't points to anything. Suppose he wants something, right? But he doesn't points to it, right? So he or she will take your hand or your finger and point to it. So that's a very important identification that something is actually wrong. Even there will be speech delay, like, babbling. So in 12 months, if you don't see your child babbling, in 15 months, you don't see your child is speaking a single word. If you don't see that two meaningful word could not be spoken by your child to express his or her requirement, then there is a problem. But there is an exception also. I don't know, I will keep it to the audience. That is, I have seen child like they're absolutely normal, their development have actually flourished till 2.5 years of age, and after a specific vaccination. I will not talk about this vaccination because it's a global platform, so I will not talk about that. But after that, there is some problem, and all of a sudden there is no eye contact. All of a sudden the speech goes, and there is a retraction of everything, like cognitive behavior, its IQ, everything actually regressed. So that is a part of regressive autism. It's a part of it. A study is going on. But what is the etiology, whether it is genetic or it has been induced due to some environmental factor, that's a question. So this thing may also happen, that is, even you have a normal development, all of a sudden one day you see that this kind of symptoms are there, and you think that since you are not talking to them, or he or she is not being put into a school, and that's why he's not talking, is not that much social. That may not be the point, because instances are there where doctor has said that you put it into the school and it will be okay, but it's not at all okay, because this didn't work. So you need to understand that what is a difference between a typical behavior and an atypical behavior. So it is an atypical behavior where you get to see this repetitive behavior, unproductive play. That means child always play in a productive way, like constructing a building out of blocks, or cooking. Female child usually do such things. So productive play, that there is a meaning of what he or she is playing. But if your child is playing in a unproductive way, having no meaning at all, right, you don't find out that what he is doing, right, then that is something alarming, and you should take action. Not action, I will rather say some therapy, because we know that we don't have any medicine, because I said from the first part of my video that each and every child is actually different in the spectrum. That is their phenotypic expression. Their expression is different in each and every child. So of course the genotypes, maybe there is some polymorphism change in their genes, or some different kind of regulation that need to be identified in order to develop a precision medicine, customized medicine for these children. So that's why that is under research. But these are some of the identification points, right? Their cognitive failure, right? You will not be able to see that they are being able to write, or they are being able to read, or they are being able to concentrate. Because sometimes what happens with this autistic spectrum of disorder comes another symptom, right? In most of the child I have seen, right, that is attention deficit hyperactive disorder. They are very much hyperactive. You will see that all the time, in many cases, in 90% of the cases, that autistic spectrum of disorder has been clubbed up with attention deficit hyperactive disorder. So I will complete my video here with some basic questions I have answered, like what is autism, what is autistic spectrum of disorder, and how will you identify it in its early age. Though there are so many different questions which parents ask, which I will be answering in my later video. Thank you so much for listening.